When last did you examine your scrotum? Hmm, you don't know. Some of you, since the day you are born, you have not touched your scrotum. Every man has two balls in their private part called the testes that is found inside a bag called a scrotum. And you need to be touching and examining that scrotum from time to time because there are cases of testicular cancer. And the best time to examine it is actually when you are under hot water because there is this small muscle that surrounds it called the dartos muscle. When it's cold, the muscle contracts itself and make it hard to observe the scrotum. But when you pour hot water on yourself, it can get to that place and relax the muscle for you to be easier to touch and examine. Now, let's talk about how to know the normal and abnormal testes. So, what does a normal testis looks and feels like? A normal testis should have an oval shaped, similar in size to a small egg. Then one testicle being slightly bigger and hanging lower is normal. Then if the texture is smooth, firm but not hard, no lumps, not painful when gently touched, it is normal. Both testicles should be inside the scrotum. One may hang lower. This helps for temperature regulation and it is normal. During your examination, if you feel a small tube behind the testis, which may feel like a soft cord, it is called the epididymis for sperm maturation, storage, and transport. It is normal. Then slight difference in size between the two testes is normal. Then scrotum might tighten in cold weather and then loosen in heat. It is a normal reflex. Now let's talk about abnormal testes. When you notice a sudden change in size of the testes, one may become much bigger or smaller than before. That's a sign. Then a hard lump or mass that is painless is a big warning sign. Feeling of heaviness in the scrotum as if you are carrying a bag of water down there. This is a sign. Then constant pain, especially in the lower abdomen or groin. Then scrotum swelling with fluid can make the testicle look larger and it is normally referred to as hydrocele. Then we have the testicle pulled high and not dropping down can mean torsion, which is a medical emergency. Then redness, heat or fever, mostly infection. All these things are signs of abnormal testes and requires medical attention. Now let's talk about the early warning signs of testicular cancers, which includes one, a painless lump on the testicle, which is the most common sign. The lump may be like a small pear or bigger. That's a sign for you to go to the hospital for proper examination. Two, one testicle suddenly feels harder or heavier. Then three, change in testicle size, bigger or smaller. Four, dull ache in the lower abdomen or groin. Five, fluid in the scrotum which appears swollen. Then six, which is a back pain and it is the late sign. Please, if you see any of these signs or any lump that is hard, painless or increasing in size, that is a sign for you to go to the hospital for proper examination. Thank you for watching and see you in my next video. Bye.